Welcome. Hey, Nick.
What's up? What's
You're
up? What's
on.
up? Yeah, man, me there.
Just playing a little bit of music before
Nothing wrong with that.
you logged on. Okay.
Yes,
So
yes,
it's
yes.
officially 6. All right, welcome everybody. Welcome. It is another episode of Therapy Tuesdays with me, Lesli-Ann Belnavis Elliott. I am a registered art therapist, been practicing in Jamaica for a while now with children and adults with different needs, emotional and psychological concerns. Started the Therapy Tuesdays out of COVID and just wanting to have conversations with different professionals in the field, whether they're medical, mental health practitioners. And today we have a special guest, Mr. Nicholas Bromley, but I now need to call him Dr. Nicholas Bromley,
It's all good. It's all
physical
good.
therapist with Rehab Oasis. So if this is your first time, it's just gonna be a conversation. Feel free to ask your questions put your questions or comments in the comment section below. So Nicholas,
Mm-hmm.
welcome.
How you doing?
I am good. So I know this is your first time as a guest, and for those
Yes.
who might be new to watching Therapy Tuesday with me,
Turn
is
on the
that I
light.
always do a check-in with whoever I'm interviewing with, and check-in is really something that's practiced within different therapeutic environments where we kind of
Sure.
do things to ground our clients.
Okay.
So it can be a repetitive thing that's done at the beginning, and then something is done at the end, which is called, I learned this a few weeks ago, harvest. So we have a check-in and we have a harvest.
All
If
right.
you do feel
Sounds good.
motivated by the end to do a harvest, I know we talked before, but if the vibes reach you, you can. So the check-in activity for today, and our viewers can feel free to write the comments in the comment box, is I want you to
Mm-hmm.
think about how you're feeling right now, Nick. And whatever that feeling is, you can decide whether you want it to be a color, a shape, a sound, or you can make the movement showing how you feel right now.
Okay. Okay.
So you want?
Um. Wow. Let me think. So, based on the current situation, outside is a bit bleak here with this Saharan dust blowing over us, unfortunately. But somehow my mind is still thinking of a color blue. I am feeling good. I'm feeling
Okay.
healthy, and I'm just happy to be here to share with your followers and your subscribers. On Art Therapy JA. So
Thank you,
I'm
Nick.
here. I'm here. Yeah, man.
No movement. You never do no movement.
Boy,
That's
but
troubling
we
you.
we we have all been so long quarantined that I've forgotten how to move. Which is what we are going to be talking
Gonna
about a
talk
little bit
about
today.
later. Yeah.
Yeah, for real.
So for me, my shape, I found some
Hmm.
Play-Doh. It's really a rectangle. It's supposed to be a bed. I'm
Okay.
a little bit tired, but I am also feeling purple and feeling excited to have this conversation because I've gotten a lot of feedback
Sure.
about concerns concerns about situations regarding persons who are senior citizens. So that
Sure.
seems to
Sure.
be, people really want the information. So
Right.
speaking of information, Nick or Dr.
Hmm.
Bromley,
Hmm.
can you tell us a little bit about who you are, what you do, and what age clients you work with,
Okay.
and what their conditions are?
Sure. Hi, everybody. Dr. Nicholas Bromley here. I began tertiary studies at UWI in the Faculty of Pure and Applied Sciences. At first, I was doing biology, physics, and math. And then I decided that I wasn't really happy where I was there in that faculty or with my career path. And so I did a little research, heard about physical therapy, or as most people know as physiotherapy. Hi, Elliott. Yeah, so I decided to switch over to MedSci, where I got into the physiotherapy program. I graduated in 2005. Thereafter, matriculating into working after a year of internship at UWI Hospital. So I worked at UWI Hospital for 10 years from 2006 to 2016. And while at the hospital, you know, you rotate through various specialties such as orthopedics, intensive care, general surgery, medicine, and pediatrics, just to name a few. So I had to treat patients with a wide spectrum of, you know, disabilities, injuries, problems, infections, this and that. So then in 2016, I moved on you know, into private practice. But of great note, in 2017, after 10 years, I decided to go back to school, where I pursued a transitional doctoral degree in physical therapy again at the Nova Southeastern University in Davie, Florida. So currently, I'm one of the owners and operators of Rehab Oasis, which is a physiotherapy clinic. And myself and Dr. Dave Foster, we are both the directors and operators of that clinic, you know, and it's been going well. And also, just the last little bit is that while pursuing the doctorate, I also decided to specialize in a specific thing called manual therapy. Right?
What's that?
So manual therapy basically is a skilled set of hand movements which aid in chronic pain relief. It deals with manipulation and mobilization of joints, muscles, and soft tissue mobilization. So it is really, really, really good for pain-related problems, you know, musculoskeletal issues. So that's what manual therapy is.
When you say musculoskeletal problems, for those who are not in the science arena.
So, okay, in layman's terms, so musculoskeletal means issues that are concerning joints, bones, muscles, tendons, and ligaments. So when you say musculoskeletal, it encompasses all of those, you know, organs. Yeah. Basically.
Okay. So Nick, can you define exactly what physical therapy is, and how is that different from occupational therapy, as well as from somebody just doing physical activities like a PE teacher?
All right. Well, physiotherapy.
Just talk freely, man. Just talk free.
Right. So by definition, physiotherapy is basically a profession which deals with the treatment of disease, injury, or deformity by the use of physical methods such as heat treatment, massage, exercise, and it is an adjunct to medical practice where they more institute surgical procedures or medications to aid with somebody with any pain or disability or disorder. So that's what physiotherapy is by definition. So it's really just to deal with disease, injury, and deformity disorder, right? Now, in terms of you asked about how it differs from, I would say, like a physical trainer or a PE teacher. All right, so basically, the big difference is that a PE teacher, whilst they would understand how to implement and carry out an exercise program geared toward a particular sport or activity, physiotherapists, or physical therapists as I call it in the US, can assess and diagnose problems or injuries and, you know, use different methodologies to bring about a treatment and get rid of that problem. So that's a big difference. So we can treat actual problems, diseases, disorders. That's basically it.
And what's the difference? Go ahead. Go ahead. What's the difference? You go.
you go.
What is it? No, you didn't finish your point, so go ahead.
No, I was saying, and physiotherapy doesn't only deal with musculoskeletal issues. It deals with neurological issues. It also deals with respiratory care, treatment of patients with stroke, or people who have, had a heart problem, a heart attack. All manner of things are encompassed within the scope of practice of physical therapy or physiotherapy. Yeah.
And persons might not know that I can work in conjunction with you as an art therapist on a
Definitely.
case. Because I have worked with
Definitely.
a few physical therapists in training, not just in
Correct.
training, but out here in Jamaica, with
Sure.
mostly with persons with disabilities, with like
Mm-hmm.
cerebral palsy or
Oh, yeah.
global developmental delays.
Right.
So we can work together.
Right.
But the
Right.
other question was, Nicholas, is what is the difference between it and occupational therapy?
Hi, Daniel. So as far as I understand it, occupational therapy has to do with certain specific um, rehabilitation protocols to do with persons who need to perform a specific task. And as the word
Like tie the
suggests,
shoelace or something,
tie the
or
shoelace, hold a spoon to feed themselves, brush their
so,
teeth, or even, let's say the person has a shoulder problem and have developed a disability where they can't raise their arm above their head, but they work in a factory where they have to take things off a conveyor belt and put them on a shelf. Now their line of work or their work duties
that's
will be
back
affected.
injury. Yeah.
So occupational therapy has to do more with a specific task that needs to be accomplished. So there
Okay.
is a bit of crossover between occupational therapy and
And physio.
physiotherapy.
Okay.
Unfortunately, in Jamaica, though, there are a very limited amount of occupational
Oh,
therapists. So we have been bridging the gap for
for
those
the
kinds
two.
of things. Yes, definitely.
Okay.
Definitely.
So, Nick, let's get into the meat of the matter with the
Sure.
focus right now, which
Right.
is, looking at maintaining physical health and wellness for senior citizens. And I know
Right.
when I approached you about the topic, and with what's happening with COVID-19, how there are restrictions.
Oh, yeah.
There are restrictions. Sorry, I just saw cases cases.
Yeah.
Where there are restrictions on persons who are ages 65 and over, right?
Sure.
I know that when I have worked with senior citizens in the past, some have
Yes.
struggled emotionally with losing a sense of independence. Some experience loneliness. Others have
Yes.
physical conditions or medical conditions that impact their mobility. And others may have conditions like dementia or problems with their memory. As I mentioned before,
Okay.
with COVID hitting, it causing restrictions in terms of them being able to be active. How can this, what are some physical ways that this can impact them? And in your practice, what are the concerns that you see are impacting senior citizens right now?
All right. So, as you mentioned eloquently, basically, seniors are being advised to stay home. The pandemic has really riddled us helpless in terms of our mobility. We are still under certain restrictions of work hours and traveling hours, etc. And by no means this has been extended to our seniors even more so. But just to put into context, what is a senior? And by definition, well, according to the World Health Organization, a senior citizen is anyone over the age of 65.
Mm-hmm.
So as we know, they have been advised to stay home, even though our churches and other social activities have been somewhat opened back up. Our seniors are still being advised to stay home. So
stay home.
the question is, how does this affect the seniors? First of all, not being able to travel as much, not being able to move around outside of their household has rendered them, a little bit, it has deconditioned some patients or some persons in that, class of society. There are lots of seniors who have what we call non-communicable diseases, which we have a very high incidence of in Jamaica. So, for example, diabetes, hypertension,
Arthritis?
Arthritis is not really a non-communicable disorder.
Okay.
It is something that develops with age. and it can develop in younger years too, but more so in the older population.
Okay.
What we find is that being restricted to being at home, most people aren't really keeping up any sort of level of activity. They're sitting down a lot, they're watching TV, they're not really keeping fit, they're not
Moving.
going out walking like before, you know. So what you find that they can develop a higher incidence of worsening of their pre-existing
Condition.
symptoms and conditions. So let us say, for example, you know, an older gentleman who used to go to church, and that was his basically one of the
Outlet.
few outings he had for the week, apart from maybe going to the supermarket or the pharmacy. You have now restricted him to being home. He can likely develop circulatory issues, which can lead to a DVT, which is a deep vein thrombosis. He can have, you know, worsening of all kinds of other problems as well. And most importantly, being cooped up in the house has a severe impact on mental health, right? Because think of it this way. Sitting down all day, it can cause you to develop pain, or it can exacerbate chronic pain issues that you've had. It can cause back issues. And when you have this pain and you're just sitting there not doing anything about it, it can actually cause things to get worse, right? And when you are in pain, it actually worsens your mental state. It can cause depression.
Yep.
So,
and that's where I come in and work with you. But yes,
so,
sorry. Go ahead,
right.
Nick.
So the suggestion is that no matter who it is, whether you're a senior or not a senior, we are always advising persons to keep active, right? Even if it's just to walk around the house or sit and stand. There are several things elderly people can do. There are some easy exercises that can be done, and so on. And the good thing about exercise, even to a small extent, it actually helps your body to release a chemical known as endorphins. Now, endorphins have a direct impact on pain, right? And when you have a reduced incidence of pain, right, it actually makes you feel better. Endorphins also are known as the feel-good hormones of the body.
Yeah.
Right?
And there is
so
also
when
tied to psychological impact as well. But yeah.
Exactly. So what I find, and I'll give you an example of my mother, who she's a teacher. Although she's retired, she was still very active at her school because she's a musician. She helped with the orchestra. She was teaching violin lessons and so on. And now that her movement is restricted, I find that her affect is not the same. She's not as bubbly. She's a little bit more agitated, easily aggravated and so on by little things. So I do see the effects that it can have being, you know, at home. So this is the effect that COVID has had in particular, so far in my observation. Yeah.
I agree with that. I think even staying still, that does impact a person's psyche.
Yes.
But what about for those who, one, they may want to be physical but can't be, or what if the person doesn't have the motivation to be fit to, they don't know how to start to just be physical, you know, and especially if they're elderly, if there are some restrictions, how do you motivate them to do that?
Okay. What I tend to do personally, there are certain days in the week where I have a little bit of free time, maybe an hour. And I have some patients who I might have discharged in the past, or there are some persons from my church community that I have their phone numbers, and I call them and I check in on them. So one of the things we can do as younger people and family of these senior citizens is to, you're at work every day, you're out there earning your bread, but take a little time out of your day to check in on your older population, your family, your brethren who gone a foreign and his parents are out here. Call their family every now and again. Say, hey, how you doing, sir? You know, how you coping? You know, just sometimes just a conversation is what you need to have to encourage people. it doesn't really take any big effort. You know, it would be nice if the older population were a little more comfortable with technology and could log on to YouTube or Facebook and follow a little exercise program, whatever it is, you know. So there are various methods, but just a simple phone call from a friend or a loved one can definitely make a big difference for some of these people.
Yeah,
man.
And that goes back to what I said before, that when I found that working with persons, senior citizens, some really experience a high level of loneliness. So now with the added restrictions, there even more. There's also what I want to say.
Yeah.
There's even more distance. There's even more isolation. So checking in with a person, as you said, or doing something as a family as best as possible, or a neighbor, because sometimes their family is not even close by. That really impacts the psyche. And I know that in working with senior citizens, they just wanted to feel like they could belong. They're doing something. They have a sense of independence. They can. So even if it's maybe just water in the garden, that is something physical too.
Oh yeah. So what
Nick, Go ahead.
No, what I do, some of them, I will say to them, boy, what you been up to? You know, how is the garden? How your grass dealing with the heat? And sometimes just asking little questions like that will encourage them to get up out of the couch that they've been sitting in for the past 4 hours to go look outside and say, Lord, the plants, them could do with little water, you know, and they will go outside and actually water the plants. Hey, activity is activity. I don't mind. So I'll take that, you know, if it's even that. Yeah, man.
Okay. I don't know if you answered this, Nick, but if it is a senior citizen that happens to have a disability or a physical impairment, what are some physical tools or activities could be used to support them or support their well-being during this time?
Okay. Let us say someone with a back issue, right? Who is of that age. The good thing is that there are physical therapists who can do house calls, you know,
like
going
yourself,
and
right?
checking on the person. I do that as well. There are certain days that I do house calls, and some days I'm actually in office all day as well. So the thing is, you can still access your healthcare professionals like me to come in, assess your situation, make suggestions. And the good thing about it is this: a lot of the rehab tools necessary for a lot of these disabilities and disorders are not expensive nor require any grand equipment. Sometimes it's just certain simple exercises. And a lot of the research nowadays has shown that exercise has a similar outcome to using what physiotherapists call modalities. So if somebody has a back pain and every day they just put an ice pack on it, and they're not doing any exercise, you're just treating a symptom. Yeah, you're just treating a symptom, but you're not getting rid of the problem. So the point is that simple things like just a little movement, a little exercise here and there can have a big impact on chronic pain issues and disability, right? Okay. So that's why it's so important, you know, and we are here to come in and help our patients with that. Yeah, man.
So if there are any senior citizens who can't physically move but need the support, they have access to Rehab Oasis services
all day.
Of rehab.
all day.
Just a question, can you explain what the term geriatric means and that to senior citizens?
All right. The thing about it is this: when you talk about geriatric, it's not a term that we use it, but it's not really a term that we like to use a lot. We use more politically correct terms, but a geriatric person is one that is an old person. And when we say geriatric, it tends to be related to ailments or their health care. Okay. When we talk about senior citizens, it's just an age group.
It's general, yeah.
A general age group. But when you say the word geriatric, it tends to speak to someone who needs special care. All right. So I don't like to, I tend to not broad brush people over a certain age and call them geriatric, right? Because it has a certain connotation to it that,
Connotation. Yeah.
right. And
I
I
see.
will tell you something. Yeah.
Mm-hmm.
You go ahead. Go
Go
ahead. Go
ahead.
ahead.
Nick, go
Okay. So
ahead.
what I've found over the years is a simple thing. Age does not dictate ability. What I mean by that, I've had patients who are well into their 90s that can get up, they go outside, they water their garden, they wash their own dishes, they cook their own food same way, right? Your abilities
Mm-hmm.
are not tied to your age, the number age, right? A lot of people, once they have passed the age of retirement, they tend to just feel like this is it. I must cock up my foot now and do nothing.
Mm-hmm.
I must become sedentary. And this is what a lot of people, as they retire within the first 10 years, leads to their demise in health. And their mortality, declines or well, their mortality rate is worse
Increases.
off,
Yeah.
increases. Yes. So that is really what I've found. So all those who are out there, you have your family, your friends who are seniors. I want you to remind them that their age is not a sentence to them, for them to just sit down and do nothing, right? There are things for them to do. Yes.
Okay. I love that, Nick. And two comments. One from your mom. Well,
Okay.
somebody, Auntie Winsome said helpful, thanks. And then, hi, Mrs. Bromley. She said that the
Hey,
physiotherapists can
mom.
advise their caregivers as well. And I think that's important. That's important too.
Oh, yeah,
With
definitely.
talking to caregivers or family members about how you can support senior citizens during this time. And then I see Kelsey has a question. How do you, as a physiotherapist who takes care of everyone and aid to their beck and call, how do you take care of yourself in the process and your mental state? Oh, that's a good one.
Wow.
Because as therapists, how are we engaging in self-care when we are dealing with
Okay.
clients or patients in your case, and then you are even more hands-on, Nick. You have to physically touch the person, so that's a
That's
lot
true.
of
That's true.
you're using a lot of your body and putting that
Right.
energy into your client. So
Right.
how do you answer that question that Kelsey just
That
asked?
Kelsey. All right. Thank you for that question, Kelsey. And hey, hope everything's good. So first of all, being a healthcare professional, you have to realize that, for me personally anyway, I get some sense of accomplishment, some personal joy out of seeing the reaction from my patients, right? And from my clients. So first thing is, when my patients recover, when their goals are being achieved, when my patient who did a hip replacement is now able to get back in his car and drive, the pleasure that I see on their face affects my mood, right? It
Mm-hmm.
makes me feel good because I know that I am making a big impact on their life and their well-being, right? That's the first thing. Now, the second thing, and I think it's very important for us as healthcare professionals, is to ourselves remain physically active, all right? So personally, I work out. Every now and again I play tennis, I ride my bicycle, I go all over the place. And for those of you who follow me on my personal Instagram
Page.
page, Leo_Bram, you will see all the shenanigans I'm up to on a weekly basis, right? So you'll know what's up. So you have to also, as a healthcare professional, as I said,
Take care.
keep active and take care of yourself. Go get a massage sometimes, go to the beach, check in with your friends, hang out with your friends, be sociable, just like anybody else would. But that's an excellent question. But the main thing for me professionally is to see how much of an impact I have on somebody else's life that gives me that peace of mind and that sense of well-being, to be honest with you.
Yeah. I think as
Right.
therapists, all of us, we feel a sense of joy when we see that there's an impact. In
Right.
my case, it's the change in the client and what they create and what comes up and what statements they do and how they're moving forward. For you, it is, I presume it is, how they're engaging physically, how are they responding,
Right.
are there
Right.
improvements?
Right.
So I think that's great. So Nick, as we prepare to close, I love what you said, and I hold on to this gem or therapy tip, is age does not dictate ability.
That's
And
right.
so that's a reminder for senior citizens. As Siveral said, yes, I agree.
Yeah, man. Real talk.
Thanks, Adrian, for tuning in. I see you.
Hey, Leslie.
So
Other
withholding,
Leslie.
with states saying that age does not dictate ability, is there one tip that you can leave in terms of for caregivers, in terms of how they can support
Okay.
for senior
So,
citizens during this time?
so what the caregivers need to remember is that the more they encourage their charges or their patients or their family to move, right, the less of a burden the patient potentially will be for them. Because if the person remains functionally independent, then it is easier for them to care for them, right?
Yeah.
If you have a situation where you make a conscious decision to sit down all day and you get weak, you have a problem going to the bathroom, then the caregivers are going to have to help them to go to the restroom. But if you walk with them outside, just take them under the mango tree, let them get some fresh air, have them just walk around the house, sit down, stand up, eat at the dining table rather than in their bedroom. Little
Well,
things
yeah.
like that make a big, big, big difference in their overall health, well-being, mental state. And that's
Okay.
my 2 cents on the issue. Yeah, man.
Thank you for that, Nick. So as we prepare to close, can you tell us where you can be reached? I know you mentioned it before, and if there are any projects that you're doing
Oh, yeah.
right now.
So, Rehab Oasis, we can be reached by phone, on WhatsApp, or by calling on 876-789-2466, or you can find us on www.rehaboasis.com. Please go and check out our website, where you get all the information you need on all the services we offer. You can also find us on Twitter at Rehab Oasis JA, or, as you know, on Instagram at Rehab Oasis. So, whole heap of ways to reach us. You know how to find me. Call me, text me, message me, see me on the road, hail me, no matter. You can find us.
So, Nick, as we close, there is a checkout or harvest activity.
Yep.
I don't know if you've decided to do one. If not, I will do mine.
Do yours. Do yours.
I will add on to what we did at the beginning. Just think of a color, shape, or movement of how you're feeling, as well as complete this statement. I can, I am, I will.
Okay. Okay, wow. You first. Let me go. Okay. I can, I what? Go again. I
can, I am, I will.
Okay. I can make an impact on somebody's life today, right? I am the best person right now to get people to move. And I will strive for excellence, right? And ensure that all those who I come into contact with keep moving, keep healthy, keep fit, stay alive. That's it.
I don't even know if I can finish after that. But I asked the viewers to put it, you can fill it in the comment area. I will say, I can continue to support persons using art therapy. I am driven and creative, and I will continue to push through with Art Therapy Jamaica and supporting persons of all ages. And speaking of continuing, next week we will be featuring Sky Jarrett. So we'll have 2 more episodes, and until we finish the 10 episode season of Therapy Tuesdays with Art Therapy JA.
Tuesdays.
The next week will be Sky Jarrett, who is a transformational life coach and mindfulness instructor. And we'll be talking about mindfully thriving through crisis. So
yeah, man.
See you guys then. Please be sure to check out Art Therapy JA on Instagram, as well as if you've missed the videos will be shown on IGTV after this, as well as it will be aired on the Art Therapy Jamaica YouTube channel. So be sure to go over there and subscribe. So next week again, guys, at 6 p.m. With Sky Jarrett.
Live.
See you then. Thank you, Nick. Thank you, everybody. Create My Art Story. You can catch it at the end. You can catch it on the IGTV. So thanks, everybody. Thanks again, Nicholas. Stay active, stay creative, and see you guys next week.
Keep moving. Peace out. Thanks again, Leslie. All the best, and thanks, guys, for tuning in.